welcome back. The topic today we are going to discuss is about gluten sensitivity or gluten sensitive enteropathy. Probably you have heard from your friends saying my doctor told not to eat wheat. I went to the doctor for itching, he said stop taking protein or stop taking wheat. So this is what you call gluten sensitive enteropathy. It's nothing but an allergy to the protein called gluten. This gluten is more present in the wheat, that's why it's called wheat protein. So allergy to the wheat protein causing damage to the small intestine. Entero means small intestine, pathy means disease. So it's nothing but an allergy. It's an autoimmune disease. Autoimmune means our immune system is acting against our own body. So it's an allergy to the wheat protein. So the immunity attacks the small intestine. Okay. Overall can be affected. Usually anyone can be affected right from childhood or in the middle age group usually. And women are more affected. 2/3 of the patients are women. And overall prone to this. People with autoimmune diseases like type 1 diabetes, autoimmune thyroiditis, autoimmune hepatitis, psoriasis, rheumatoid arthritis, these are all autoimmune diseases. Those people who have autoimmune disease, they are all prone for this kind of gluten sensitivity. Okay, what are the signs and symptoms? Usually they present to the doctor. Mostly they go to the gastro side or to the skin doctor. So the gastro side usually, since as I told in the previous videos, our small intestine is a 18 feet long digestive organ which has a function of digestion as well as absorption of nutrients. So when the inner lining is affected by the autoimmune immunoglobulins attack the inner lining of the small intestine. So what happens? They can have abdomen pain, bloated feel, diarrhea, and they will have a nutrition deficiency. See, because small intestine has not only digestion, also nutrition absorption. So they absorb mainly the protein, calcium, all these things. So nutrition deficiency can happen. Like suppose there is a deficiency of iron, so they can present with anemia. If they have a deficiency of vitamin B12, again anemia, or aphthous ulcer, mouth ulcers. If they have a deficiency of calcium and vitamin D, so then the bone density will be very less. They can, osteopenia, and they have a very light bone density. So these are the weight loss because of the diarrhea, loss of appetite, they can lose weight, and most of the time these people are treated for gastritis which is resistant to treatment. So only after some time the doctor can come to a conclusion, okay fine, so is not responding to the regular gastritis treatment, so it could be something else they can think. Then other presentation is they usually go to the skin doctor saying they have itching. They always have trichia, so they say itching. They can have patches. Sometimes they go present with vitiligo or depigmentation or white patches, itching or red pigmentation, or alopecia areata. They have a loss of hair because of the autoimmune disease. The inflammation causes hair fall. So they go to the skin specialist, and these are the presenting signs and symptoms. And usually the doctors, when they examine, they ask questions, clinical examination, and usually they rule out other causes of the diseases, and finally they come to a conclusion it could be. So what are the tests usually they do? Usually the gastric symptoms, the endoscopy, colonoscopy, a scan, or blood tests. Blood tests can show anemia, vitamin deficiencies, especially iron, vitamin B12, calcium, vitamin D. These deficiencies can be there, and they are asked for immunoglobulin. Usually the immunoglobulin IgG and A, they will be elevated, and IgE will be less. these things can pinpoint probably it could be because of gluten sensitivity. Okay, what is the treatment? Since it's nothing but allergy to the wheat protein or the gluten, when you stop taking the gluten, that is a simple treatment. So if it's right from childbirth, the child born with gluten sensitivity, they have a alternate food or supplements which are gluten free diet can be given. And most of the adult, they have a very mild symptoms, or we call that a dormant disease. They may not even know that they have a gluten sensitivity. They have a very normal life and without any problem. But some people will have this kind, a severe form which has nutrition loss, weight loss, abdomen pain, diarrhea, all these things. For those people, they may sometimes, people they can develop into lymphoma. So these are the people who need treatment. Like what? First again, the diet part, then specific drugs which can act on the immune system, and steroids. All these things can be given. So how to diagnose? Simply or suspect. Generally we say people with gastro symptoms when skin problem like itching, pigmentation, white patches, urticaria, anemia, mouth ulcers, gastric symptoms which are not responding to the regular treatment. So these are the people we suspect gluten sensitivity, and they will be subjected to the investigations, and the treatment is specifically addressed to the signs and symptoms. So gluten sensitivity is an allergy to wheat protein. In autoimmune disease, an allergy to the protein which affects the inner lining cells of the small intestine, and treatment is very simple. Thank you.